Bismillahirrahmanirrahim. Quote of the day. Nations are born in the hearts of poets. They prosper and die in the hands of politicians. By Lama Iqbal. I am Dr. Ahmad Wahid Khan, PGR, MPH Community Medicine Department, King Edward Medical University, Supervisor Professor Dr. Saira Afzal. Today, the topic of presentation is AIDS. Learning outlines. Introduction, epidemiological triad, chain of transmission, levels of prevention, treatment, recent advances, and MCQs. Introduction. Acquired immune deficiency syndrome is caused by human immune deficiency virus, HIV, which breaks immune system of body. If anybody get infected with HIV, his body will try to fight the infection. It will make antibodies, which is special molecule to fight HIV. Origin: scientists identified a type of chimpanzee in West Africa as the source of HIV infection in humans. The earliest known case of infection with HIV-1 in a human was detected in a blood sample collected in 1959 from a man at Democratic Republic of Congo. Problem statement: HIV continues to be the major global public health issue, having claimed almost 33 million lives. The estimated 650,000 people dying from HIV globally in 2021. Latest estimates. Global prevalence among adults, the percentage of people aged 15 to 49 who are infected has leveled since 2001 and was 0.7% in 2021. There were 38.4 million people living with HIV in 2021, up from 30.8 million in 2010, the result of continuing new infections and people living longer with HIV. Of the people living with HIV in 2021, 36.7 million were adults and 1.7 million were children under age 15. Although there have been a significant decline in new infections since the mid 1990s, there were still about 1.5 million new infections in 2021, or about 4,000 new infections per day. HIV remains a leading cause of death worldwide and the leading cause of death globally among women of reproductive age. However, AIDS-related deaths have declined due in part to antiretroviral treatment scale-up. Types of HIV. There are two types of HIV: HIV type 1 and HIV type 2. The HIV type 1 is more predominant worldwide, more virulent, has subtype M, N, O, and B. M is most predominant. Subtype M has strain A, B, C, D, F, G, H, J, and K. While the type 2 is mainly present in West Africa, less easily transmitted, longer period from initial infection and onset of illness. HIV epidemics and different epidemic scenarios. Low level HIV epidemics, HIV prevalence among HRGs below 5%, among general population below 1%. Concentrated HIV epidemics, HIV prevalence among high risk group more than 5, and generalized HIV epidemics, HIV prevalence among general population greater than 1. Epidemiological triad, which include environment, host, and agent. First, we will discuss about the agent. Human immunodeficiency virus. Retrovirus family RNA virus replicates in actively dividing T4 lymphocyte. Unique ability to destroy helper T cells. Mutate rapidly kill by heat 20% either acetone or alcohol. resistant to ionizing agent and UV lights. Source of infection. Virus has been found in greatest concentration in blood, semen, and CSF. Lower concentration have been detected in tear, saliva, breast milk, urine, cervical, and vaginal secretion. Host factors. Age. All age are susceptible, more common in 20 to 49 years. Gender. Both genders are susceptible. High risk group include IV drug abusers receiving unsafe injection, blood transfusion, and medical procedures that involve unsterilized cutting or piercing, male homosexuals and bisexuals, heterosexual partners experiencing accidental needle stick injuries, including health workers. Mode of transmission, sexual transmission, contact, maternal to child transmission. Sign and symptoms. The symptoms of HIV vary depending on the stage of the infection. The disease spreads more easily in the first few months after a person is infected, but many are unaware of their status until the later stages. In the first few weeks after being infected, people may not experience symptoms. Others may have an influenza-like illness, including fever, headache, rash, sore throat. The infection progressively weaken the immune system. This can cause other signs and symptoms like swollen lymph nodes, weight loss, fever, diarrhea, and cough. Without treatment, people with HIV infection can also develop severe illnesses, tuberculosis, cryptococcal meningitis, severe bacterial infection, cancers such as lymphomas and Kaposi sarcoma. HIV causes other infections to get worse, such as hepatitis C, hepatitis B, and monkeypox. HIV diagnosis. A person's blood is tested for the disease-fighting protein, antibodies to HIV. Two type of antibody test, ELISA and Western blot, are used to identify HIV infection. Saliva and urine can also be tested for HIV. A person who is tested for HIV should also receive counseling from trained HIV/AIDS specialists. Levels of preventions are tertiary care level prevention, secondary, and primary. Primary prevention includes awareness about the disease, practice safe sex, sterilization of instruments used for cutting or piercing, no sharing of razors, injection syringe, and toothbrushes, screening HIV in blood or blood product or for transmissions. Specific protection include chemoprophylaxis with antiretroviral therapy, pre-exposure, post-exposure, preventing mother-to-child transmission. Post-exposure prophylaxis (PEP) is the use of the antiretroviral drug after the single high-risk event to stop HIV seroconversion. PEP must be started as soon as possible to be effective and always within 72 hours of the possible exposure. Perinatal transmission or mother to child transmission and prevention. HIV can pass to offspring through placenta during delivery and by breastfeeding. Recommendation to test all pregnant women for HIV and start HIV treatment immediately. Give HIV medicine to her baby for 4 to 6 weeks after birth. The risk of transmission can be less than 1%. Elective cesarean section before onset of labor or rupture of membrane, refraining from breastfeeding. Recommended first-line AR regime for treatment pregnant women and the prophylactic regime for infant. For mother, antepartum AZT plus 3 TC plus NVP twice daily. For intrapartum is AZT plus 3 TC plus NVP twice daily. Postpartum AZT plus 3 TC plus NVP twice daily. And for infant is AZT for 7 days. Treatment. First line ART for adults include two nucleoside reverse transcriptase inhibitors plus one non-nucleoside reverse transcriptase inhibitor or antigrase inhibitor. Routine viral load monitoring at 9th, 12th, and then every 12th month. Treatment failure 1000 copies of virus per ml after 6 months of treatment initiated. Second line for ART for adult is two non-nucleoside reverse transcriptase inhibitor plus protease inhibitor. Tertiary prevention, HIV-related infection, cotrimazole managing opportunistic infection and cancer related to HIV. Recent updates. The epidemic of HIV/AIDS in developing countries, the current scenario in Pakistan. Abstract. HIV causes AIDS in which the immune system of body totally fails to develop any defense against the foreign invaders. Infection with HIV occurs by transfer of blood, semen, and breast milk. HIV/AIDS is a global problem and result nearly 25 million deaths worldwide. Developing countries like Pakistan have issues regarding public health. Currently, epidemic of HIV/AIDS is established in Pakistan, and there is threat of an expanded HIV/AIDS outbreak in the country. The major reason is that population is engaging in high risk practices, low awareness about HIV/AIDS, and precarious blood transfusion practices. Supplementary threat to A supplementary threat to Pakistan is India because both sharing a border, and India is facing a rapidly growing HIV/AIDS epidemic. Local NGOs, national and international organizations are warning that in near future, Pakistan may experience bad situation regarding HIV/AIDS. In the present article, we focus current situation of surveillance HIV/AIDS, its virology, genotype, diagnostic higher risk group, reason of vulnerability in Pakistani population, and the role of different national and international organizations in this situation. Now it's time for MCQs. Question 1 is scientists identified a type of chimpanzee in West Africa as a source of infection in humans. Human immunodeficiency virus is A. Lentivirus, B is Capriporovirus, C is Gall virus, D is papilloma virus, and E is pox virus.
D. Papilloma virus.
The correct answer is A is lentivirus. Question number 2, HIV prevalence in Pakistan general population is believed to be less than 1%, with 165,000 people living with the virus. Pakistan is in which stage of AIDS epidemic? A is concentrated epidemic, B is generalized epidemic, C is low level epidemic, D is high level epidemic, E is epizoonotic.
C.
Correct answer is A, concentrated epidemic. Question number 3. Which of the following is the best strategy to prevent mother to newborn transmission of HIV in developing countries? A is elective C-section, B is antiretroviral therapy. C is immunoglobulins to mother during pregnancy. D is contraindication of breastfeeding. And E is spontaneous vaginal delivery.
C.
The correct answer is B, antiretroviral therapy. Question number 4. A house officer get pricked while doing blood sampling of HIV positive patient. Which of the following is best screening test for HIV AIDS? Option A is antigen detection. Option B is antibody detection. Option C is nucleic acid detection. Option D is CD4 count. Option E is complete blood count.
A.
D.
B.
CD4 का नहीं A.
Quest, it's B, antibody detection. Question number 5. AIDS is potentially life-threatening illness caused by HIV. The condition significantly affects the body's ability to fend off infection. HIV can spread through sharing water, breathing in infected droplets, C, sharing needles, D, kissing, E is handshaking.
C. Sharing needles.
C.
Yes, C
C.
is correct answer. Question number 6 is select the incorrect option given below for the common route of transmission of HIV from one person to another. A is unprotected sexual contact with an infected person. B is from infected mother to the fetus. C is sharing needles. D is exposure to contaminated blood and blood products. E is using sharing the same swimming pool.
E.
E is correct answer. Question number 7. All of the following statements regarding HIV infection in human is true except A is person once infected will remain infected for life if untreated. B. Monocytes and macrophages are the major reservoir of viruses. C. There are mainly three stages of HIV infection, with AIDS being most severe stage. D is the possible symptoms are fever, chills, fatigue, mouth ulcer in an early stage of infection. E is medicines are available for complete cure of the chronic stage of HIV infection.
E.
Correct answer is E. Question number 8. Which of the following bacterial infections is predominant in chronic HIV infected patient or AIDS? A. Pneumocystic pneumonia. B is tuberculosis. C is candidiasis. D is toxoplasmosis. E is endocarditis.
B.
B is correct
C.
answer. Question number 9. All of the following are examples of clinically important specimens that are used for the laboratory diagnosis of HIV infection is except A is blood, B is saliva with the presence of blood, C is genital secretion, D is urine with no presence of blood, and E is semen. D is correct answer. Question number 10. Name the possible source of transmission of HIV in humans that is believed to have first occurred in Africa. A, duck, B is pig, C is cow, D is chimpanzee, and E is a monkey.
D. D.
Yes, D is correct answer. This is the key of all the questions. These are the references through which this presentation has been made. Thank you. Here's the link for our YouTube channel.